Mr. Speaker, I'm proud to yield 2.5 minutes. The gentleman from Oregon, the top Republican on the Energy and Commerce Committee, Mr. Walden.
Gentleman from Oregon is recognized for 2.5 minutes.
Thank you very much, Mr. Speaker. This package is not the first response to the COVID-19 pandemic, nor will it be the last. The American people expect us to set partisanship aside in times of crisis and do what's best for our country and for our constituents, and that is what we are doing today. We're helping health care providers on the front lines back home get the personal protective equipment they need and the medicines and medical devices that will save the lives of their patients. We're helping people who have lost their jobs get a lifeline. We're helping our small businesses keep their workforce together. And we're making record investments into finding treatments and a cure. We're helping our state and local governments too. We're all in this together. And with President Trump's leadership, we're all in this to win as fast as medically possible. In order to prevent our health system from collapsing under the weight of this virus, we will provide unprecedented support for our nation's health care providers, including $100 million for hospitals, labs, doctors, and increased reimbursement for treating COVID-19 patients. We dramatically expand production and distribution of medical supplies by providing liability protections through the PrEP Act for respirator manufacturers, including $16 billion for the Strategic National Stockpile to procure medical countermeasures, such as personal protective equipment, ventilators, and $11 billion for manufacturing, production, and purchase of vaccines, therapeutics, diagnostics, and other items to address the nation's medical or preparedness needs. The CARE Act opens up the fastest computers in the world at our national laboratories for research and analysis related to the COVID-19 virus. We help EPA expedite the ability to get disinfectants into the market more quickly to protect the public from this virus and prevent its further spread. And in a volatile oil market, the CARES Act smartly delays a mandatory 2020 sale of oil from the Strategic Petroleum Reserve through 2022. Included in this package are improvements to expand access to care through telehealth, including $200 million for the FCC for telehealth services and devices, and expansion of telehealth services in the Medicare program. It extends vital Medicare, Medicaid, and public health programs, including community health centers, among many others, until November 30th this year. We mobilize the nation's health workforce by providing liability protections to those who provide volunteer medical services during the public health crisis and by standing up the ready reserve. And we take steps to protect our medical supply chain, something that I hope Congress will continue to work on after we pass this legislation today. Today's Phase 3 approach is the most comprehensive and robust response to COVID-19. Together, we're going to win this war, and I yield back.